Hi, everyone, and thank you so much for joining me. My name is Nikki, and I'm a health equity education coach, and I help academic nurse leaders to bypass the trial and error of common mistakes in teaching diversity, equity, and inclusion so that students are prepared for the rigor of practice. And it is still the season of the nurse, and it's the last week of May, and I want to ask you to think about nursing students and think about if they are developing the skills of professionalism adequately. Professionalism in nursing education involves demonstrating a high level of ethical, moral behavior, including respect for patients, colleagues, and of course, the healthcare team. And it also involves adhering to professional standards and maintaining a professional demeanor in all interactions. So, for me, when I was in nursing school preparing to become a nurse, professionalism meant that I showed up on time, that I wore the uniform as instructed, that I demonstrated interest in the content if I wasn't, and showing competency, right? And there are several reasons why our nursing students may be struggling with professionalism. And these may include things like a lack of understanding of professional standards. So someone has to teach it, someone has to guide them in understanding what it means to be a professional nurse. Personal challenges. A lot of our students are dealing with different types of accommodations, other types of life struggles, stressors that are impacting them, and we have to be sensitive to those things as well. Lack of role models is another thing. If our students are not witnessing their peers that are modeling professional behavior, their faculty, their clinical instructors, then they may not see the importance of modeling it themselves. I think that's a really big one, and lack of experiences. There are a lot of students that are coming into these degree programs as a second career, and there are many of them that are not doing that, that are coming in right out of an education or academic program into another academic program. So they may not have as much experience on the job. And as I've stated before, I believe that the expectations have changed in the nursing profession, and nursing students don't seem to be required to demonstrate professionalism in the same way. So, what can we do about it? Because I really do believe that we want to maintain the standards that we've set in our profession. And there are many things that I think can be done, and nothing is too late. The most important thing to me is that clinical instructors and faculty work together to require students to demonstrate competencies and to create a process of feedback when they don't. So people don't change behavior if there are no consequences. So you have to go ahead and get comfortable with providing feedback. So nursing instructors should provide constructive feedback to nursing students on their professional behavior and on their performance. And this can include feedback on communication skills, teamwork, ethical decision making. All of these are components that are really important to being ready to practice. Nursing schools and clinical instructors should be the role models for students to observe and learn from. And that's what we want to be. That's what we strive to be. But sometimes we get a little bit tired and we may not be just demonstrating professionalism across the board. It's important to be consistent about it. And this can include experienced nurses who demonstrate the professional behavior. So, nurses that have been in the profession for a while, even not, if you're demonstrating professional behavior, you are, right? And it may be nurse faculty who are also modeling that professional conduct as well. Also, offering mentorship and coaching opportunities, I think, is really important. So, helping our students, helping our faculty to become better at providing feedback, to become better at modeling the behavior that we want to see, I think is critically important. And sometimes mentoring and coaching can be in the form of one to one meetings with faculty, experienced nurses, really to just discuss professional goal development and strategies. So, what do you think? What else do you think we can do to encourage the development of professionalism in nursing? I hope you've enjoyed our conversation this month. We spent a lot of time talking about nursing students and ways in which we can enrich them and some of the challenges and the barriers that they're facing that's keeping them from being prepared for the rigor of practice. If you have things that you want to share with me, please jump on. Please find me on YouTube at Transform Nursing and follow me so we can have even better conversations. Take good care.